Good morning. This is Mike Berkley. I'm the founder and director of the Berkley Center for Reproductive Wellness here in New York City. I want to welcome you to our website and thank you so much for watching. So I want to tell you a little bit about me and a little bit about what we do here at the Berkley Center for Reproductive Wellness. So first off, I'm a licensed and board certified acupuncturist and a board certified herbalist. And I'm the first acupuncturist in the United States to specialize solely and only in treating those with fertility challenges. I've treated thousands of patients and I've had multitudinous successes. And whether you're trying to get pregnant with IUI or IVF or even donor egg, there is utility to using acupuncture and perhaps herbal medicine in your protocol. So let's talk a little bit about why acupuncture or how acupuncture can be of benefit to you when you're trying to get pregnant naturally, via IUI, or with IVF. Well, there are several reasons why individuals face fertility challenges. A very common reason is poor egg quality due to advanced maternal age. And so what acupuncture does is it enhances the flow of blood to the ovaries, which contain the follicles, which contain the eggs. Remember, blood is nothing other than a messenger, a taxicab, if you will. Blood is carrying FSH and LH from the brain to your ovaries, to your follicles, to the eggs. Blood is carrying oxygen that you inhale. Blood is carrying nutrients. So with the improved hemodynamics or improved blood flow to the eggs, you're going to undoubtedly get better egg quality. Now let's talk about implantation failure. One of the reasons for implantation failure is a thin endometrium. In order to get pregnant, the reproductive endocrinologist wants to see his or her patient with a lining of at least 10 millimeters. In fact, you can get pregnant with a lining of 6 millimeters, but you will never get pregnant with a lining that is 5 millimeters thick. So utilizing acupuncture can successfully thicken the lining. Now, let's say that you're a patient with a history of endometriosis and you've had a laparoscopy. Everything is good. There's no male factor. You have good embryos because they're tested with pre-implantation genetic diagnosis. They're chromosomally normal. And they transfer them and you don't get pregnant. Why not? Because even though you've had a laparoscopy, you will always contain some amount of endometriotic tissue no matter what. And that means that you'll have some amount of inflammatory proteins circulating in the uterus. So acupuncture and certain herbs and certain supplements have shown evidence and impressive results in reducing inflammation. So if you're a patient with a history of endometriosis and you're having a problem getting pregnant, even though there's no known cause, it's undoubtedly due to inflammation. And so acupuncture and herbs might be something for you to think of. Now let's talk a little bit about male factor. So if a man has low volume, low sperm count, poor morphology, poor motility, these things can all be improved with acupuncture and or herbal medicine. There are some cases, of course, where male factor cannot be improved. Some of those cases may include a major varicocele, undescended testes as a child, causing sperm problems, having radiation therapy or chemotherapy due to cancer, a genetic abnormality, something called a microdeletion of the Y chromosome. None of these things can be helped with acupuncture or herbs, but there are many men that have sperm problems that are not due to these problems that show very good results when using acupuncture and or herbal medicine. So the way it works is we do an initial consult with you that takes about an hour and a half, and then we treat you twice a week leading up to the embryo transfer, assuming you're doing an IVF. And then on the day of transfer, we treat you pre and post embryo transfer. I'll explain that a little bit. Doing acupuncture pre-embryo transfer flushes the lining with blood, making the lining more amenable to an implantation. Now, after a transfer is done, the uterus spasms, which may cause the deposited embryo to flow upwards into a fallopian tube, causing an ectopic pregnancy. Let me give you some statistics. The ectopic pregnancy rate in the non-IVF population, I believe, is between 1 to 2 or 1 to 3%. In the IVF population, it's between 2 and 8%. And the reason for that is due to the spasming of the uterine cavity after the deposition of the embryo. So acupuncture post-embryo transfer either greatly reduces the spasming or stops it, thereby significantly reducing your chances of having an ectopic pregnancy and therefore increasing your chances of having an endometrial implantation and, God willing, a successful pregnancy. If you'd like more information about what we do, or if you want to schedule an appointment, please feel free to give us a call at 212-685-0985. We're friendly, compassionate, loving, caring, very experienced practitioners, and we are here for you. Thank you so much for watching, and Godspeed on your journey to family. Bye-bye.